of the year, just because we thought the one in December might be, thank you for recording that, Liana, might be a little bit close to Christmas. So we do have some good topics today on patient portal, and then we will, as you can see by the agenda I've got up there, and then we are doing a bit of a wrap up at the end, which is great. So we may as well jump straight in. So I will stop sharing and I will pass on to Ethan from Think Cohorter, and he will introduce Cook Street Health Centre as well. So over to you.
Thanks, Petria. Morena koutou, everyone. My name is Ethan, working here at Think Cohorter Primary Health Organisation, and I've got the privilege today of introducing Jane Ayling, who's a Director of Quality and Culture, and Dr. Alvina Young, who's a Clinical Lead for Healthcare Home at Cook Street Health Centre. We've been working on a few different healthcare home projects over the last couple of years, with the most recent one being the implementation of Open Notes. So they're happy to share their experience regarding the process they've taken and just some feedback that they've had as well. So I'll start the presentation with a small video that we've recorded for our annual report, and then we'll get into it. Technology problem, sorry.
Yeah, I was like, I believe in you.
I can do it. Alrighty. So can you see that all right?
Yes.
Cool. Hopefully the sound is playing for you all.
Yeah.
Kia ora, my name is Alvina. I'm one of the general practitioners working at Cook Street Health Centre. It's been great working with Healthcare Home at Cook Street Health Centre. We have very good leaders. We have a team that works very well proactively and trying to deliver a better healthcare for our patients. Recently, we have worked at Open Notes. This is where patients have access to what the clinicians have written in their consults. Apart from the clinicians, which would include general practitioners and nurse practitioners, nursing notes are also included. We see that Open Notes is important as part of our team and our patients because it provides clear communication to the patients. Patients are able to check out and read follow-up plans that is written in the consult. It also empowers patients in having more control over their healthcare journey. Before going into Open Notes, we were worried about potential complaints that might come up. We were also worried that we wouldn't write the notes properly or accurately as the patient. So far, we haven't had any complaints. And also to help with the process, we have done a glossary of abbreviations that we would commonly use, and this will be uploaded as part of resources on My Embassy. To other providers who's thinking about Open Notes, I think it's a good way to potentially boost the numbers of people who are enrolled on the portal. Our numbers went up by up to about 49% at the moment. And I think at the end of the day, we just have to be honest and clear with our communications and not overthink it and just do it.
Excellent. So hopefully you're all still with me. So that was a video from Cook Street Health Centre. And so one focus this year for our Healthcare Home program has been to celebrate provider stories because we know that providers can influence other providers better than PHRs can. So so once again, thanks Alvina and Jane for putting your hand up and doing that for us. Did you have a question, Petria?
No, sorry. I was trying to give it the clap and I accidentally clicked on there.
Oh, Not a problem. Okay, then, well, we'll get into the presentation, Jane, and you can just let me know when you want to move on to the next slide, and I'll hand it over to you.
Thank you, Isan, and thank you for giving us the opportunity to just really tell a little bit about our journey. Our journey is not unique at all, and I think open notes is a lot easier than everyone thinks they're going to be. So I'm going to hand over to Dr. Alvina Young, and she's going to start the process.
Next slide, Isan. So we'll start off with the why. We thought that, having patients, if they have access to their notes, it will help with their sort of self-management. Because we do think that when we arm patient with the right knowledge and right information and the right advice, that will empower them to actually take control of their own healthcare journey. And hopefully that will also mean a better health outcome for them. I've had a few sort of messages coming from the portal going, oh, you said this in the notes, can you clarify, or clarifying the dosage of medications that I've written and all that kind of stuff. So I think that was actually very positive from the patient, who actually kind of going, there's something wrong with this. Can you double check for me? So that was very good. Patient also have a right to their sort of own clinical notes as per the sort of privacy code that is written there. So I guess it's only natural that this will be part of the next process. Last but not least, also to gain healthcare home certification, we need to demonstrate that we can use open notes. So we're just trying to kill multiple birds with one stone.
Next slide, please, Isan. So we looked at the how, and we thought, well, actually, we knew a year out that we were going to go to open notes, but we thought we won't let everyone know because everyone will just, really early on. So we had a team discussion about it on the 1st of March. And that was a really interesting chat because we were prepared for a lot of negativity and a lot of questions. And everyone was really keen. Why not? Let's just go for it. So then I thought, well, I've got to keep myself on track because I'm quite good at getting sidetracked. So I did a PDSA cycle and just started that process, because I think PDSA cycles for me are quite inherent in what I do, and I've got lots in my head, but I had to write it down. So that kept me on track. We went out and gained some feedback from other practices. We've only had 2 other practices in our region that did have open notes, and that was Kāori Healthcare and Fielding Healthcare. So I asked them both, and they just said it was actually really a no-brainer for them. They just turned on the switch and they hadn't had any problems at all. So then it was back to the team, and we chose a date, and that was the 1st of June. So everybody had that date, and as you do your huddles, it was in the huddles, and it was on the notice board in our tea room, so everyone knew the date. Then we had a discussion with Kamatua and Kuia, and unfortunately they were a little bit not very well at that point, so we didn't do a face-to-face, but we did a phone conversation which lasted about 25 minutes, and they were both on speakerphone, and they said, why don't we do it sooner? They just thought that it would be really good for the whānau, and they were really positive about it. And they look forward to it, and they've commented since that they really like seeing what's written in the notes. They always go back and have a look because they haven't actually got everything on board when they leave the consultation room. So they've been really, really happy with it. So moving on. Isan, next slide. Yeah. We sort of developed a workflow on how, do you want to explain that a bit about the workflow, how we developed that? We just talk as a team really about how we were going to do it, and the workflow was really around the appointment scheduling. So our appointment scheduling, we've aligned to the College of General Practitioners recommendations, and so we have 1 hour clinical administration time per session. So that seems to work, and those that have got more complex patients that have 20-minute appointments, they do 80 minutes of clinical administration time, which would give them that time, because the clinicians were a little bit worried about increased workflow of emails and and their provider inbox. So we allowed that time. I put together a policy and guidelines, and that was approved by the team. So the communication for the team, I tell them what I'm doing, and then put it together, leave it in the tea room, and send it out as an email to everybody. And also a gentle reminder on our team Facebook page. Please check it, please comment. I take no comments as you've approved it. And, you know, when you do that and it's going to be signed off, then all the comments come in, which is great because everyone leaves it to the last minute. So there, I've just said really the team's prepared via the meetings, conversations, emails, huddles. We did a communication out the day we went live. We chose other practices that I've spoken to didn't do any communication to patients, but I thought actually we need to let them know what's going on. So we did just a communication for all those on the portal via email about what was happening. And that caused, in our PDSA cycle, you'll see later on, that caused us quite a lot of work. Because sending out an email, there was a lot of people that forgot their logins. They had registered but not activated, so our phones went nuts. But that was all positive, and I think we got something like an increase of 200 activated patient portals over that week. So it was a positive, but it wasn't something that we'd anticipated. So that was the thing. So we just also put receptionist onto it. We just managed it with one receptionist dealing with those portal inquiries via email, and also too a lot of the older population came in, so it was really lovely to see. We've got a couple of receptionists that are really good with the portal, so it was really good to see their interactions and getting them all set up and started. Then we thought, you know, we're renowned in health for these acronyms, and it's like, you know, what has that person actually written? So we've done a glossary. So again, that glossary was a team input and actually a patient input too, because, you know, patients said, what's this, what's that? So we always put it down and we've included in the glossary, and we've just uploaded that onto the resources in my indice. Next slide, Isan. I think that's about it, really. Oh, there's my PDSA cycle. If you really want to have a look at it, you can go to the next slide. I just use this one because I've used this one for years. It was just the whole thing around the plan really gave us a time to keep us on track. You can just go to the next one, Isan. It's really all very straightforward. Just your normal predictions. The glossary is a living document, and we're looking at updating it about every 3 months or so. Next slide. It's the last bit of the PDSA. So we have increased our number of portal users. We're over 50% now, and we are going to talk about how you're finding it good managing the emails from patients.
Yeah, they're generally pretty good, and usually if they're writing an essay, I usually reply back with a one sentence going, can you make an appointment? But yeah, no, they're pretty good. Yeah, I think you know, sometimes they didn't know about this, where, you know, if say someone had a rash for like 2 weeks, they can't get in, you know, until 3 weeks down the line. I told them, hey, you know what, you can just send me a message with a photo and I might be able to get to it in 2 days, you know, that kind of stuff. So I think it sort of improves communication and their management of their sort of conditions and all that kind of stuff.
The other one that we didn't predict, my indice had a version update in app 2, so that caused quite a lot of extra work as well. So we got a lot of people forgot their passwords again and things, so there was a lot of administration on that. But we have been doing okay, and currently one of the receptionists is contacting all those patients that have registered but not activated, and we're concentrating on Māori and Pacifica first. I think we've got 250 at the moment, and we've got that down from 372. So we're just chipping away at that as we've got the time. Next slide, I think, is questions, Isan, isn't it? Yep, that's us. Over and out, short and sweet. Any questions?
I actually did have a question. Have you had many complaints about after opening the open notes about, you know, people reading them being like, oh, I don't agree with what was written in there?
Interesting, because we've had 2 that have been around their diagnosis that have been there forever that they had access to.
Oh.
So it was about diagnosis, and one was about obesity, and the other was about alcohol intake.
So overall, I
So
mean,
that's all.
actually
And
very
yeah,
positive.
yeah, absolutely. We asked the team, what have they had? And that nobody has said anything. And also talking to the other two larger practices, which are integrated family health centres, they've been really, really surprised. They might have had one or two.
Yeah, because that's sort of the feedback we get, in the past quite a lot, is that, a lot of the resistance was like, oh, there's going to be so many complaints. But, I have spoke to a couple of people that have turned it on, and it's sort of the same, one or two, but actually way less than you're expecting.
Yeah, and as Alvina said, was a patient just clarifying a dose of medication, or did you really say that? We did a lot of work, though. We did a lot of work around language and the expectations. So we did PowerPoint presentations at the team meetings about your notes and your use of acronyms and the language of not using emotive words. Yeah. So, and if it's if something, I can't, if a patient has said something, put it in quotation so that you're actually saying this is what the patient said.
I think there were some issues about the word declined.
I'm just going to bring it up. I just can't remember where it is now. Just fire away with questions if you like.
I've got another one, but did anybody else have a question they wanted to bring up? Look, I'll just keep going. Did you find that, sort of after people being able to act, I think we sort of briefly touched on this, but was it quite an increase in emails through the portal after the notes were open? Because you did say, you've had a few queries, was it quite a significant increase in emails after the notes were available?
No, I think the same kind of person will keep emailing regardless of whether they have their notes open or not. I don't see it as I don't think I've noticed any increase. Yeah.
I think doing repeat prescriptions, and they're everybody's nightmare, repeat prescriptions. You've got patients that are actually, it's given them another avenue to put their repeat prescription. So they've also left a message on the script line, they've done an email, and they've phoned receptionists who sent a task to the prescriber. So I think it's just been another avenue. But again, they're the same people that will do it. So, it's a very small. I'm just looking, I've just brought up my PowerPoint that I did around documentation principles. It was about using specific language and avoid vague words and generalizations. Complete notes with information related to patient condition and care plan. Always be objective and avoid judgmental or critical words. I think that's really, really key. Be timely in writing your notes. We did actually have some people phone up like 10 minutes later, it's not there. So that was in the initial stages, but we haven't had that. I've just remembered about that. And making sure the plan and the follow-up details are clear and concise. If you're having a difficult conversation, I think that was about the specific suggestions, difficult conversations, it's important enough to put in the note. If it's important enough to put in the note, it is important enough to talk about it. So if you're going to write something around something that's a little bit difficult, if it's important to put in the note, then you need to have that conversation with the patient. Avoid jargon, abbreviations and acronyms, because we don't want to have that misinterpretation by patients and whānau that are looking at those notes. And offer a balanced perspective, especially for mental health issues. Describe the patient's strengths and achievements along with documenting the clinical issues at the time. This can help the patient gain a broader context within which to consider illness and approach difficult behavioural changes. They were really just the key things. Plain language, aware of bad phrases, and discuss the diagnosis before adding. I think we learned the hard way, but I think you're always going to get that. Sometimes, when you do a BMI, that for a while there, those codings were coming up automatically.
I think that glossary, putting it on, is such a good idea, because that is like, I remember when I first got Open Notes, I spent a bit of time Googling what things meant. And so having that glossary there available for them at the start, it's a great idea. I love what you guys have done.
We're really happy to share it. I will send Isan, I think you've got my policy and procedure with with everything at the back. And if you think of anything else, please let us know, because it is a living document. And rather than us all trying to reinvent the wheel, I think it's really important that we share our documentation.
No, that would be great, actually. I was like, that would be a really useful document to sort of have on hand to share with people that were here today. And I just had one last question, because, we're still at 5 minutes, and got to really get the best out of it. With sort of your, just in general with your portal and the emails, did you put in quite sort of clear guidelines about sort of length of messages, and as Alvina was saying, like, it was a really lengthy message, it's 1 word back. Do you have sort of quite a set procedure across all of the clinicians on, like, do you charge on a certain length email? How many contacts is considered a consult? Sort of, have you got quite strict guidelines on that?
No, we haven't, because I think everyone's an individual and every clinician is an individual as well. So, and they all have their unique behaviours and the way they interact with patients. That's not a negative.
Yep.
They're unique, and that's the way it is. And I know that it goes against lean thinking and a lot of the healthcare home program, but patients, their needs may differ. And at that point, there may be a lot more email traffic than there would be normally. So it is, again, it's that therapeutic relationship between the patient, whānau, and the clinician. So we've left it quite broad. The charging's getting better. It was, when do we charge? Do we just charge for a yes response or whatever? No, you don't. It's got to be flexible. And also, again, it's not always about the money. The money's very important, and that's my job. I've got to manage the money in the practice, and that's also very important. But you want a quality service, and you want patients to be able to use the tools provided for them to make workflow better.
Amazing. That's great.
Okay.
Did anybody else have any questions? I think we've covered a fair.
You think covered it? Yeah. And I can't see why patients don't want to. I mean, why practices don't want to do it.
Yeah, I think, from sort of the discussions I've had, I think a lot of it is that fear of complaints, perhaps, and having to change sometimes, like the way that you are writing notes. Like, I think some that's sort of some of the feedback I've gotten, but I'm hoping sort of it'll increase as time goes on, because it is so valuable.
Yeah, and you can flip that coin on complaints. Complaints are a good thing. I get worried if we don't get any, because it's about how you continually improve. And I much prefer they come to us to complain rather than tell all their friends.
Yes, that's very true.
So I think, you just got to flick it about there, and we do have to look deep into ourselves sometimes and think, well, perhaps we shouldn't have done that. So, let's improve and own it. Own it.
Yeah, hear that whānau voice.
Yeah, own it.
Yeah.
Anything else anyone else would like to ask?
Have you got anything you want to add, Ethan?
Not really, no. Thanks, Jane and Alvina. Yeah.
Yeah, I want to, thank all of you for coming on today. It's been, really interesting. It's always great to hear, from people that have implemented it and how they've done it, and loved the video. Always great. So, I mean, if there isn't any other questions, just want to thank you guys for coming on. It's been amazing. Feel free to stay on for the rest of the session if you'd like, but if you've got appointments, feel free to jump off. So we will be moving on to, we've done, I will actually let Nee, thank you guys. I will let Nee introduce herself and do a little bit of a blurb.
Thank you, Petria. Kia ora everyone, kia ora koutou. Ko ni Brunenberg, tōku ingoa. My role here at the Collaborative Aotearoa is Digital Lead, and I am based in Wellington region. So it's lovely to meet you all, and thanks for having me. So just a little about my background for those who don't know me. In my past life, I worked at dental practice in the Hutt Valley as finance, claims and debt management, then joined Water Compass Health in 2020 and became a college endorsed assessor for the foundation standards, where I worked and supported GP practices across the Wellington and Wairarapa regions with their accreditation work. So I've had the privilege during that role, being part of that we worked in an internal equity working group where Ignite some of my passions about health equity, and we formed a peer group and learning session there with the Kawhina Mana Taurati, which is the equity champion across that network. And within recent years at Te Water, I then trained in change facilitation, supporting the continued implementation of the enhanced healthcare home model care before joining Collaborative. So that's me. Yeah, good. Looking forward to seeing more of you and hopefully connect with you in a unique capacity. So yeah.
Thank you, Nay. It's great to have you on the team. So I will share our presentation on patient portals, and I'll let you do the first quick bit, and then I'll jump in for the rest. So let me just share that. Now I can't remember how to make it presenter. Ready?
Good. I've only got one page, so I'm good. So yeah, so I guess patient portal. Yeah, so from the beginning, I think it really signals significant change in the way we practice, and I think Cook Street Medical really highlighted that. And I think overall across New Zealand, we've seen significant opportunity that teams using it as a tool to allow our patients to interact with us more meaningful ways. And I think it really became a game changer, reflecting back in my early years in general practice. So yeah, but that being said, before I pass that, I'll go back to Petria. I'll just who's put together this presentation, this really lovely presentation. I'll just share with you some benefits of patient portal and just how pivotal it's been, and I think it remains to be in today's digital health landscape, and it's evolving very quickly. And you gotta see what's going on, otherwise you get left behind, I guess. So yeah, as previous people on this course call have said, it really, I think this is a pathway that enhances the experience and quite fundamental, I think, in strengthening our goal. And we want to engage with our patient and everyone in general as well. And I think this is a really good tool. It also encourages patient empowerment, very patient self-care and self-centric. And it contributes to also health literacy over time as well. And also, lastly, but definitely not least, as the team had mentioned at Cook Street, I think it improves, efficiency and accuracy in your information that you record. Down below there, you can see there's a quote that I've just literally copied and pasted from Manage My Health, who, by the way, is our biggest portal provider. I think they cover 50%. Is that right, Petra?
Pretty
Petria?
close to, yeah.
Yeah, close to. So they're our biggest key player. So this quote's from a staff member in Tauranga who found that they, it's cut a lot of the phone calls down at reception and the nurses that they process. So yeah, I will hand the mic back over to Petria to talk further.
Amazing.
She's done some research.
Thank you. Yeah, so what we have done is, we were doing the open notes with, Cook Street and Think Water today, and then I was discussing with the team. I was just like, look, I've had some requests through the, sector that what other portals are actually out there, sort of what, so many people with Manage My Health. And then when I was actually working in PHO with the practices, I did get a few queries of, who else is out there? So we've done a little bit of a project, and we're just going to do, it's a comparison essentially just of, I guess, the most important parts of the portal. So I've gone online and just had a bit of a look sort of what's available throughout New Zealand. And the main 5 is Manage My Health, Vensa, Health 365, Centric, which is Web Tools, and My Indice. So I did reach out to all of them. I managed to speak with somebody at each one apart from My Indice. And so most of the information here I've actually got, sort of like firsthand from the patient portal, and My Indice was sort of gathered a bit from, a PHO and what we can gather online. But it's a fairly accurate comparison. Now, we do know that there is always development, so these things will change, but this is sort of as it stands now. So I've ran through, and first off, I've got portal costs, because this is definitely one of the most important parts for a practice. So I have just done a comparison of all of them there and their setup costs. Now, Vensa was quite interesting because you can do the portal only, and they've got another sort of standalone program, Text to Remind. And if you sign up for a Text to Remind bundle, you get Vensa with it. So then I've sort of done the two costs there. A lot of them I tried to have it comparable as sort of how much is it per month. And I mean, I've got all the information here so I can share this slide, but I will just say, Manage My Health does have quite a big setup cost, but they did say they do deals on that quite regularly. Health 365 was 1,000, My Indice and Centric was nil, and I just hadn't really heard back on, I sort of reached out to grab a little bit of extra information from Vensa, but I hadn't heard about any setup costs. So Manage My Health is $1 per year per enrolled patient. They do review that quarterly, and you can contact them with what your current enrolled population is if it dramatically changed, and they'll adjust the cost. That is very similar to Health 365, 5 cents per enrolled patient. That's per month. Sorry, that should be in there. And then Centric, same thing, $1 per year per enrolled patient. So, reviewed quarterly as well. And they do, because all of these are charged monthly, but Centric does do an upfront discounted 12-month license fee, which was quite great. So if you lock in that enrolled patient population, you get a discount. And then with Vensa, as I was talking about, so it's a bundled system. So if you do the portal only, you're actually just charged by usage. There's no cost to have the portal. You just get charged sort of for the charges incurred by scripts or prepayments. And he sort of gave me an average of about 50 to 100, depending on your usage, which would depend how many patients are obviously using it. And then with Vensa, with the Text to Remind, you have bundles, and that's it's a subscription, so from $79 up to about $109, plus SMS charges, and that sort of depends on how big your practice is as well. We've got sort of what services do they offer. Everybody is quite similar with that. I tried to keep it quite sort of standard with appointments, scripts, lab results, notes, direct messaging, recalls, reminders. And you can see like the majority of them all are yes. Centric have recalls and reminders coming soon, and Health 365 have direct messaging for a fee, which was quite interesting. But it's pretty standard on that aspect. So which portal patient management systems do these portals integrate with? So all of them, well, not all of them. My Indice obviously is just with Indice at the moment. Centric, Web Tools, Health 365, Vensa, Manage My Health all work with MedTech 32 and Evo. Vensa is currently working on with My Practice and in discussion with Indice. Health 365 also does My Practice, and then Centric was very interesting actually. They're working on an Indice integration, but they also will be integrating with any other source system. So secondary care, so like physios, pharmacies, hospitals, if they have the platform available, they are working on it currently, but will be able to integrate with that. So then that patient would be able to access not just their health centre, but also other health providers, which is a great initiative. They're a bit quite new centric, so I think they're sort of perhaps a bit more tech forward, but the other patient portals hopefully will be coming through the same as well. So I've also put in sort of just what the usability is. So is it web-based? So everybody is web-based, and Manage My Health, Centric, and in My Indice all have an app as well. And I asked if you can do video consults through that. So you can see the three, Manage My Health, Centric, and My Indice. You can do virtual consults through the web page and the app, which is great, but not with Vensa and 365 so far. And also they don't have the app. And so looking at sort of patient usability, like how to sign up, I do know in the past, like with Manage My Health having quite a big portion of the practices across the country, that there was quite a request for a phone number sign up. So they are actually bringing that in. That's one of the developments they're doing at the moment. And a point of difference for them is that it's actually free data to use this patient portal on your smartphone or tablet. Manage My Health also do whānau accounts, which is great, so you can link them together. Unfortunately didn't get that information from Vensa. It will be individual email. I just didn't get confirmation if it was phone number as well. Centric needs both. It's email and mobile, so that dual sign-in. And moving through, we're also got so our payment options through the portal, which I think is great. Like, I think it's really important to be able to pay for your scripts and your appointments online, because I mean, if online shopping can do it, why shouldn't we have it in this area as well? And hopefully it should cut down some of that debt within the practices, is having, you know, being able to pay for these things online beforehand. So all the patient portals, you can pay for your scripts when you order it, and all of them, as of the first quarter next year for Centric, you can prepay your appointments if you want. And then historic charges, that is, can you look at your account and pay your account after you've incurred that charge? Because both the scripts and the appointment are prepayments. Health 65 is currently the only one that you can actually pay a historic charge, so you can make payments off your account, which is amazing. My understanding, you can view your account, but none of the other portals at the moment have that you can sort of look at your account or make any extra payments on it. So I've done sort of IT support, because this is quite important. Sort of when you're in your practice and something's gone wrong with your portal, what is the turnaround? What are the support options available from that portal? So it is funny, we get a few, of course it's 24-hour turnaround, which is great, but I'm sure some of the practices who use some of these portals know that it's not necessarily true. But Manage My Health do have a staggered turnaround time. So they said it's 24-hour turnaround time for priority 1 help requests, if your portal's down, or those higher ones, but it is staggered for the lower priority. And they've got email, online chat, and phone support. Vensa did say that they have 24-hour turnaround time on all help requests via the same 3 avenues. Health 365 just say that it's very quick. They have a lot of people on that, and that same thing, email, online chat, and phone. Centric pointed out that their support team is actually based in Christchurch, and it's a 24-hour response time, and it is a quick turnaround via email and online chat at the moment. And he said that there is typically somebody there all day available, and that they're actually, in Christchurch available, which is quite nice. Not 100% sure on Indice. I mean, they do have on their website, it does say to contact patients, are to contact their practice, and practices can contact them. And there is a phone number and an email fill in the form chat option. I've just put in some other IT info, because there is a lot of information coming out sort of in the portal space. So I will run through what we've got here. So Manage My Health, they do have other modules available at a cost. So they've got their basic portal, just with all the sort of normal things we mentioned before. Then you can also do like online payments as an additional module. And I think it was, I want to say $30 a month, something like that. Then there is a video consult add-on, which I feel that was per user, and it did have a cap. They also have a shared electronic health record module and a shared care plan. So that was quite interesting. I asked for a bit more information on that. So that is for both those modules, which quite often they bundle together. You link in with other regional practices and the hospital. So that's, for instance, your shared health records would be within your region. So there'd be a group of you all connected together through that module. And for the shared care plans, I might have this around the wrong way, it can be with different care providers sort of just throughout the country. I'm pretty sure that one was. So you can bundle those together, you can have them separate. There's different costs for each, and there's caps and bundle pricing. You can also sign up for Manage My Health through your My Health account, and they use SSL security technology, which don't actually ask me to give you any more information on that, because I'm just not quite 100% sure. I'm not quite that tech savvy yet. Looking at Vensa, so they have that text to remind, as I was mentioning earlier. So it is a standalone, and it is similar to the MedTech text, but with more integration and features. And they mentioned that the text is right back into the PMS, which was quite cool. There are automatic campaigns included, like smoking brief and invoicing campaigns. So your smoking brief, I think, a set amount of times per year, it will, send out a text to them to get that information for you. And the invoicing campaign, it sends out sort of invoices, reconciliations, etc. With Health 365, you can choose what functions the patient can and can't use. So if you've ever seen their app, they've got sort of quite a lot of areas which you can use or not use. So you can actually you can block a patient from using a particular functionality. For instance, if a patient isn't turning up for their appointments and just keep, booking them never turns up, you can actually stop that particular patient from making appointments for a certain amount of time. So there's a lot of flexibility on the aspects of that Health 365 portal that you can, and you can turn on and off. They're very privacy focused and they hold no clinical data. They send small queries to the practice database, which allows the patient to see that information that the practice has approved, but they don't store it anywhere. With Centric Web Tools, very similar thing. They don't extract and store any data from that PMS. It's a single code-based modern tech with New Zealand-based developers. So Centric is nearly all of their staff New Zealand-based. It can integrate with multiple healthcare service providers, as I said before, and they've just recently done a partnership with BPAC with their Smart Care Kiosk and the Centric app. That Smart Care Kiosk is a standalone platform as well, and they have online Centric Training Academy updated fortnightly with new product releases, and you can do a 3-month pilot phase of the portal, and then if you don't like it, you can get rid of it. Then My Indice has a secure messaging facility, and it can send and receive attachments, view and engage with your care plan, though you can also view and engage with the care plan. And there is sort of other programs and modules available through sort of Indice, like telehealth, virtual health, bioscan, escalated. I don't know if that's what I was supposed to write, care plans. So I'm not 100% sure if those integrate with the portal or if they're another sort of thing you would have with your PMS, but that was some information I got from them. I've done future developments because that's quite important to know what is coming in the future for these portals. So we've got with Manage My Health, they are currently doing their SMS module to text through the portal. They've got a Discover Health module coming out, which is a health literacy section for patients, and Beating the Blues module, which is free to the patient, which is quite, I think that was quite cool for sort of mental health. And they've also got a brain injury screen test tool for medtech. So those two, you turn that on within medtech and the patient can access it. And I think the practice as well is it's a brain injury screen test. And they're also just currently working on integration with that medtech Meteor, which if you're with medtech, I think you'll know about. Venture are working on integration with My Practice and in discussion with Indice to do the same. And they're also working on, doing their online historic payments, and they're planning to have that in place by Easter 2024. Health 365, they do an updated version every 6 to 12 months of their portal, and practices can actually request a personalised portal at a cost. So if you were like, I particularly want these, 5 aspects, they will actually do that for you. There will just be a cost attached. Personalised portal, I think, sounds quite great. And their improvements are actually decided by their user group requests. So that's quite good, listening to the section what we want. Centric, also, they deliver a new product release every 2 weeks, and they're continuously bringing in new initiatives from their user group. They are also working on integration with Indice, and they have a Centric Connect feature. So the patient can patient lookup function through the portal. So the clinician uses that to assess the international patient summary. So that just seemed like quite sort of a handy thing for the clinician within the practice. Got other useful tidbits. So this is just other sort of general information I've sort of collected from the practices. Manage My Health is available in Te Reo, and they are bringing on, they said it was 5 other sort of core languages, and they've got, amongst those is Samoan and Tongan, plus a couple of others. They do have their whānau accounts, which has been developed. So it's just that one email address, but the whole family can kind of come under that. And you can, as I said before, you can actually, if your enrolled patient population has changed quite significantly with a doctor leaving or, perhaps one coming on, which we're not going to tell them got one coming on, change price. You can let them know at any point to update your billing. Then with Venso, I've just put a little bit more information on that text to remind, just because it is sort of quite a big part of their patient portal. I found it quite interesting. So it is a standalone product, and the text to remind integrates with MedTech as well as My Practice and Profile for Windows at the moment. And they said that the text to remind sort of helps with that continuity of care. So any patient's response can go into the provider inbox, or you can choose a different inbox for it to go to, and that's per patient. All the patient replies get written back into the daily record on MedTech. The replies do cost, but they can be subsidised, and there can be free text replies for patients. Text Remind also includes all of the basic messaging, like automated appointment reminders, bulk messaging from Query Build, one-on-one messages. And another feature is the ability to send an SMS to a patient list from a spreadsheet, which is quite good. So you can actually have text to remind without having their portal, as long as you're with MedTech, My Practice, or Profile for Windows. Without having done the research, there's all these sort of like little things out there that you actually don't know about. So I'm pretty happy I get to be sharing this with you all today. For Health 65, they hold a free training user group every Tuesday, and this is where they get their ideas to develop their new technology. They got the Nebula Copilot and shared care plans were requested at their user group and have since been developed. So that's great, sort of response to their user group. Centric, you can brand your Web Tools portal to a corporate, sort of practice owners. Like if they've got multiple practices, they'll do a brand for it, like for instance Green Cross. A lot of them have the portal. They have a Centric co-design club, so they do a fortnightly email from that. There's an online collaboration tool for feedback, and they also do a fortnightly drop-in meeting, so you can drop in here about the new initiatives. They've got a patient advisory group, early adopter program, and so the practice can join the early adopter program to get the new developments first, which is quite cool. They're currently trying to connect the patient. Sorry, I should have read this part of my notes first. Centric are trying to connect the patient to the health sector, not just the GP. So that's where their integration with secondary care. And they actually publish their feature roadmap 3 calendar quarters in advance of major features coming. So you can look ahead and see what will be coming, sort of what date that would be expected. Minders, you can actually sync with your wearables. So Samsung Health and Fitbit. So that was quite cool. So you can feed from your Fitbit, etc. You can feed in your health details into your MyIndice app. So I have got the contact details of the people I spoke to for each portal. They're all happy for anybody to contact them directly if they've got questions about that portal or about anything else. Obviously hadn't spoken to anybody in particular at MyIndice, but they do have sort of some contact details on their website. And then at Centric it was Al Duncan, which some of you may have met. He's at a lot of events. And then I've got Health 365 Vensa and Manage My Health there, so they're happy to be contacted by anyone at any time about the portals. And then we've just collated some current user feedback. So just sort of, what makes them good, having access to their own medical records, access to lab results, and when we're all patients as well as, health workers. So we, kind of know what we like about it as well. Having a patient portal helps me understand and feel in control of my long-term conditions. We've also got some provider feedback that the patients have rights to all of their medical records anyway. They've had no issues regarding the patient seeing their notes, and this sort of, does sort of follow on quite strongly from the feedback we got from Cook Street. And they've only ever had that patient feedback once. It aids autonomy, and most patients don't look at the notes, but when they do, it's positive for reinforcing information or understanding, which is great. So that is the end of my slideshow. Sorry if there was any questions during that. I could only really see my slide. So would be quite open, we do sort of have a little bit of time. I'd quite like to, does anybody have any questions for a start, or perhaps some feedback for the rest of the team about potentially one of the portals you're using? It could be negative or positive. Sort of this is an open space to really talk about anything and everything about patient portals this week. Rebecca. Welcome.
Morena, I think, yeah, it is still just checking. Quick question, really, because it's one of the things that we always struggle with is the kōrero around open documents and open notes. And so they're really, to be very transparent, don't have any practices in this region who are offering that as part of their portal. Would really love to hear how people are pitching this. We understand the importance of it from both a patient journey and also for a lean process, but we can't quite get it across the line. Really keen to hear from anybody how they've managed to do it.
So that's pitching it to the practices to ask them. Yeah, cool. Does anybody have anything they want to jump in and say in that area? Were you on for the first part with Cook Street, Rebecca?
Unfortunately not. Is it, if it's recorded, I'll watch it if you think
Yes.
it will
Yes, there is definitely a few parts in there. They talk about sort of the benefits and yeah, it is a hard one because that is, I was speaking about it earlier, that a lot of the feedback from the practices is that, there's going to be complaints. People are going to have to watch what they're saying. But Cook Street, quite interestingly, sort of did practically a little training with their staff and all the clinicians just about, the language to use. And they're going to send through their sort of policy and wording on that, just, being mindful of, acronyms and things like that. But yeah, sort of off the top of my head, I don't have the magic phrase to get resistant practices into it. But I think probably quite a good point which has come up is that, patients are allowed to access their notes legally at any time. So that is what I've heard from a few that have turned it on. They're just like, well, the patient can ring up and ask them at any time. So why not we just have it open? And then that will actually also cut down on those phone calls, because rather than a patient having called to be like, can I see my notes? I can't remember what that GP said. I can't remember what my nurse said. I can't remember the name of my medication. If you got your open notes, then you can see all of it there. Yeah. Did anybody else have anything they kind of want to add instead of just me continually talking? Nee, go for gold.
I just also wanted to express, right across the country, there are some practices that feel that privacy can be quite an issue, and that could be one of the barriers that, you have a group of people that are wanting to switch on the notes, but you've got a small group saying, no, we've got patients that share email addresses. It's a risk, it's a safety risk for certain families, and it's quite unfortunate. Although it's very important to understand that that's what they are worried about, because they may not think it's best for their particular patient. So I guess my understanding is that you would need to probably maybe just uncover a little bit as to why they don't want to, and if it is that privacy issue or patient safety, it could be a little bit sort of a little bit knowledge about some of the technology now. It's improving. There are ways to get around that, and that you could, through the reconfiguration ways of each portal, you can safely switch on some things for certain cohort and then switch off for another, if that's something they want to explore. So, the technology these days are changing so quickly that now you are, as a provider, having a little bit more control over that as well. So it could be a little bit of that.
Did anybody else have any amazing tips and tricks on getting resistant people to turn on open notes? Sort of something that's come up quite a few times is that it's actually only from the day you turn it on. Like, the patients can't see the historic notes. And I think that there has been quite a bit of worry about that. They're just like, well, do I have to go back and change all of the notes that I've made in, the past 10 years that I've been working at this practice? But with Cook Street, they did say that essentially they sort of, were quite well informed with their practice and the staff that it will be turned on from this date. Have a look at what you're writing in the lead up to that date, and then it's from that the first of that month it will be turned on. So it's only from then onwards that the patients can actually see what's written. So that probably should allay some of that fear of the historic notes and writing and what's in there. And yeah, just probably it is quite a bit of work, I guess, if you've got sort of, perhaps you haven't had open notes and it's not something you were wanting to do. There would be a lot of discussion of the pros and cons, just what are the fears of turning it on? Is it the complaints? Is it what I'm writing in my notes? Is it just the time? Is it the perceived extra work from patients calling to talk about it? Because then that's that flip side, that actually, because they can see their notes, they might call less because they don't have to ring up and ask for the questions. So, but yeah, Rebecca, I'm happy to have a bit of a session with you offline from here, see what other information I can sort of gather from the sector and send through to you as well. But did anybody else have anything they sort of wanted to add about patient portals, or just feedback on perhaps one of the portals that you're using? Like Centric's quite new, so if anybody had, you know, some feedback on that, or sort of perhaps Vince or My Indice, just because they're sort of not quite as common as Manage My Health. And I mean, if not, that's also totally fine. Just having a quick look at my agenda. Well, that presentation will be available for distribution because it's got quite a lot of good information in there. I'll try to sort of see if I hear back from Indice in the next couple of days and see if I can put some more sort of pointed information in, and just that sort of 1 or 2 points from Vince I just wanted to update. But let's have a quick look at our agenda. What have we got? Oh, Yvonne, what would you like?
Sorry, I should have come in a bit quicker. Just a question around age on the portal. Sorry.
Oh, you're just gone on mute.
Right, sorry, here we go. So the age of patients that can be registered on the portal, is that the same amongst all of them? Is it at 16, or can patients register for the portal at a younger age? And how does, if practices do that, how do they manage that? Who has access to those records?
That's actually a really good question. That isn't something I asked the portals, but just from discussing with sort of people across the sector, it does seem to be that it would be the same as when a child would register themselves on the PMS, I think would then tie directly in with the portal, because, you know, they're feeding it through there. I'm fairly certain there has been. Nope, let me take back. That was a different train of thought about 16-year-old patients. Yeah, so that is what I know so far.
So I had a question raised recently by a practice looking for a process for advising parents when, in this instance, the parent wanted to have access to their child's notes through the patient portal, and the child was under 16, so they had access to their records anyway. But what they were looking for was a process about ensuring that once the child turned 16, that the parent was fully aware that they would no longer have access, and that they acknowledged that they wouldn't have access. So first question is, does anyone do this? Because nobody at the meeting, no other practice actually allowed under 16s to go on their portal, and they certainly didn't have a process. So yeah, just if anybody has any information in that area, I'd be really interested.
Yeah, does any of the practices on today have anything in that place?
Or do they allow under 16s to go on the portal?
Yeah. I can say just sort of one part of that. When I worked in practice, we did have quite a big discussion about that, is, you know, when that patient turns 16, how do you ensure that they do or don't give permission to their parents to continue having access to their notes, or, you know, are they splitting off and having their own account? So that actually was quite a big discussion, and we were in the process of writing a bit of a policy about it. But, you know, that's when I left to go into PHO. So I do know that it is something that has come up across the sector a wee bit. And so yeah, it would be quite interesting to hear if anybody else has anything on that.
So the practice that you worked for did allow under 16s to register on the portal then?
No, we were talking about, you know, when they turn 16, what is the process to split it off from the parent, or allow them to stay under, just kind of, because that, as you're saying, you know, that parent wants to keep access to the child's notes, you know, after they turn 16, for instance. So yeah, we were just looking at a process to be like, once that patient turns 16, what are the different paths? Do we still allow, do they just completely split off? Do you inform the parent? Do you ask the child? Is it a, you know, a whānau meeting? Yeah.
And that's what this practice was actually asking is, does someone have a process or how you would go about making sure you're covering all your obligations from a primary perspective? But as I say, the vast majority of the practices that were at that particular meeting did not allow under 16s to sign up for the portal anyway. Thanks for
Yeah, I don't think it would be. I'll go back and ask the practice that I worked at and see if they did put in, you know, sort of a policy about which way to go with that. I'll go back and ask them and see what I can find out.
Thank you.
Just writing myself a quick note. Does anybody have anything they want to ask, add, respond to Yvonne? Just want to make sure I get that done. Cool. Okay, thank you for that. It's a really good question, and like it gives us such good things to think about. And hopefully, you know, maybe somebody will sort of go back to work and be like, actually, we do have that, and send it through. And you know, if somebody has brought up a question within one of these peer sessions, and then you've gone back to work and been like, actually, we do have that, feel free to send it through to any of us at the collaborative, and then we can sort of distribute those resources out to, you know, for instance, people that are asking for them within the meeting. Yeah, because we just, you know, these are all about sort of learning, sharing, you know, across the sector. Let's have a quick look at our agenda. So with this being our last one for the year, we are just doing a bit of a wrap up of the year. We're just going to look back at what peer sessions we have done for the year and just, you know, when our next ones are. I just wanted to check, is Amarjit online at the moment?
I'm here.
Oh, there we go. Welcome. So I'm going to hand over to Amarjit to do a bit of a, you know, collaborative update, talk, wrap up.
Cool. Let me just get rid of this. Board were just emailing me and stuff. Okay. Kia ora, everyone. I can't see everyone, but hopefully you are all there listening in. And apologies for not making the whole session. So lots and lots going on. Obviously, the first bit of news, which I know Petria shared, but also Leanna put on the hub, is my impending departure and moving to Think Water for the role of the chief executive. And it is something that I am really excited about and feel like it is a good next step. But it is also, you know, tinged with sadness in the sense of, you know, collaborative has been my baby, our baby for so long. But that doesn't mean I won't be one of the biggest supporters of this mahi going forward, you know, so because I just know, you know, the value of this work. So yes, just wanted to obviously share that with you. And the other, obviously, I know Nee has introduced herself earlier, but to welcome Nee into the collaborative, into this amazing mahi. We do have Coral Fitzgerald joining us early December as well, in terms of new team members coming in. So that will be an exciting time, probably a good time of year to actually come on board, because hopefully the craziness isn't you know, too crazy. So hopefully she can sort of, you know, do that induction in a bit more of a considered way. So, but yeah, we always sort of look back to look forward, and I kind of, and I'll be doing it more so because of my impending change. But you know, everything that's been achieved through the, you know, this year and years gone by, the busyness and just the support for, you know, the whole network, these peer sessions, the lead sessions, I do feel is making that impact across our sector in terms of primary and community care. I know Petria came into the role and just was, you know, we had the Health Talks Bay symposium, and I think it was, she's here for a week, and it was like, there you go. I think I was even away, and it was Jazz that provided the support and said, yep, we've got all of the presentations. And so lots of, you know, lots, if we reflect back on the mahi within the collaborative, but across the network, it's huge, you know, people are absolutely just churning out the mahi, you know. But going forward, obviously there's and I think Leanna's got some nice little photos up her sleeve next in terms of conference, but that was a highlight. Obviously, you know, the conference was was life-changing for many, you know, and the vibe in that sort of room was pretty special, you know, so I think we can all be really proud of being part of that. There is, of course, another one next year, and it will be, you know, bigger and better. I have no doubt, you know, that this movement will continue to grow, and, you know, there'll be that call for support across the network, you know, to sort of, you know, make it bigger and better. So that's in September next year, 27th, 28th of September. In Wellington again at Tarkina, because that venue worked for us and it was considerably more cost effective. Obviously the next year we'll have the ongoing peer learning sessions going as well as the Leeds Day, but also we do have the Wānanga for Healthcare Home that Petria is working up the agenda for, and has some dates to put out to the network across 6 rohi that will be shared. And yeah, I think that's probably all from me. Is there anything that you feel like I might have missed, Leanna, Petria, and Jazz, Nee? Any questions? Anybody? Put me in the hotspot. I'm happy to, you know, to be answering.
So what are your thoughts on patient portals? No, just joking.
I don't know, but we've got some good posters for them. I love my patient portal. I absolutely love my patient portal, and I wouldn't be without it.
What patient portal do you use?
I have Managed My Health.
Yeah, one of the nearly 50%.
I mean, I guess we don't get a choice. It depends on the practice, doesn't it? You know, so, you know, I use what my practice uses. They do have open notes, so which is really good. They don't allow me to book an appointment. They used to, and that is really frustrating now. Yeah, for those non-urgent appointments, I do feel you should be able to book, but they've taken that away. So yeah, so I'm a bit grumpy.
They just want to hear your voice on the phone.
Yeah, I don't think so.
Excellent. Well, thank you. That's great. You know, and congratulations on your move into Think Cohorter. That's exciting. I think, you know, Easton's very excited to be working with you, which is great.
Yeah.
Excellent. Well, yeah, if nobody has any questions for Jet, I will, what I was going to do was just do a bit of a rundown of the of the sessions we actually spoke about this year. So, you know, Jet mentioned we will be continuing to do the peer sessions every month next year, bar maybe sort of December's. We sort of, you know, wait to see how that one goes with how busy the sector is. Yeah, so just sort of a little bit of a change from probably the past year is that the peer learning sessions they're a bit more open than they were before. So they're going to be not just focused on healthcare home, but just, you know, also the other projects that we have here at the collaborative, and then just, you know, trying to focus on what you guys need, what the PHOs and the practices want more information on. So then we're going to try and do topics on that. So sort of quite relevant, useful things, you know, to share, learn, you know, discuss. Yeah, so pretty much, you know, it's open to all practices that want to come and attend, and actually just anybody else with the topics that are interested in seeing it. Like, it's definitely more of an open space, which is amazing. So our next one is January the 16th, and then I'm pretty sure next year will be in the calendar. Is that invite out for the year, Liana? Yep. And it's the 3rd Tuesday of every month. And then we send the agenda out sort of, you know, a week or two beforehand. And I will do a bit of a rundown of the sessions that we did this year. So the majority of these are recorded and they are available on our YouTube channel, which is amazing. And it's just great to sort of look back and see what we actually have looked at this year. So, and I'll just start from January run through. I've got myself a wee list here. So we did do Te Paitara Workforce with Te Wharaora right back in January last year. And then we moved into looking at pharmacy and general practice with Well South, and we looked at workforce and general practice with the Tikipunga journey with Mahitahi and Green Cross Health. We've looked at Māori suicide prevention, post-vention, and Māori order wellbeing with an amazing speaker from Te Hana Te Ko, I think I've got that right. We did self-care is not selfish with our very own Jazz, because that is very important, you know, in this sector. It's so busy, we've got to look after ourselves. Wellness practitioner in general practice working holistically, that was with Te Kipunga, and wellbeing in general practice with Dargaville. We looked at telephone systems, and that was the Amazon system with Nikki Hart from Fielding, which was very interesting. And then that moved into the care coordination team with Renee from our Marlborough PHO. Just in September, so we're getting quite recent now. Oh, we did have a July one, which I've got it written down. Apologies. Let me just double check. That was a beautiful Kororia, and we did Kororia as our lived experience, and we did the energies of Matariki, sort of using those for Horde, and it was, I heard that was a very beautiful session. I unfortunately couldn't make it. We have done peer sessions and extended workforce, which was a very popular one. That was with Amelia and Lucy from Tora. How Practice Plus can help with your unenrolled population. That was, quite interesting. We moved into managing patient debt with Donna from Pegasus, systems thinking and change with beautiful John Tau Kiwi. William from the Wanganui Regional Health Network spoke about the Pacifica Expo, which it now has been. So I would love to catch up with you guys and talk about how that went. It was such a great thing you guys were running. This month, we've obviously done open notes in the patient portal, my wonderful patient portal comparison, and that is our year of peer sessions. So heaps of content. We did quite a wide spread. Yeah, so if you were just like, actually, I missed that one, reach out to myself or Liana or anyone in the team, jump on the YouTube channel, see if you've got a copy of it there, and we can see what we can share as well. Yeah, so hopefully you've all enjoyed sort of the topics that we've had. Reach out if you've got some that you really want us to talk to about next year. Invite everybody that that wants to hear about it. Come and, listen to me jumble on for a while and hear from all of our wonderful, PHOs and practices that we get to come on. So we are going to do a slideshow which Liana has wonderfully made for us. So it is photos from the conference, so you may see yourself on it, but I do know it's a very busy time of the year. So I will actually do my closing karakia first, and then we'll jump into that slide. So if you do need to run away, but don't, because you might see yourself. But just in case, I will wrap us up. So our closing karakia. So I've got ko Ranganui e tūnei, ko Papatunuku e toku nei, ki tau te rangi marie, ki runga e tu tātou mahitahi, homie, huie, taikia. Thank you everybody for coming. Let's watch ourselves on screen. Thank you, Liana.
Thanks, guys. I really hope this works okay. Let me just share my screen and we're all good to go. I'll press start. There's music that starts, so I'll press start once I've shared. Can everybody see my screen? Yay.
Liana, you might need to click the sound button, which says, when you share it on the screens, there's an optimized sound button because we're not getting the music.
Right.
Sorry.
Okay.
I was thinking that. I was like, is it just me? Do I need to turn my computer up?
So
let me
reshare,
do something.
yeah,
I think when I share, I have
top.
to press.
Yeah.
There it is.
There
So
it
could
is.
you see me dancing along to the? Could you see me
needs to
dancing by
default.
myself or no? I'll try that again. Let me try that again. I'll just go back to the start. Okay.
I'm eagerly awaiting, hopefully, a picture of myself in here.
There's many. Right, here we go. Try that again. Ba, 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 I te tangi o te kore mako, e aha tāna e kōrero, ka huri taku aro ki te whakarongo, ki te marama I te waiata. He waiata whakaoki mahara, he mea haurane timatanga, e aha tāna e kāwea, waiata mai toa takitahi, engari he toa takitini. E hara taku toa i te toa takitahi, engari he toa takitini. Kua roa te mua mai te titonga o toku waiata. Kua rono ahau i ngā waiata o Otupuna no reira. Tuia ki tō rai. Dari dum dum dai. Dari dum dum dai. Dari dum dum dai. Dari dum dum dai. Over the melting sky, we bring our lullaby. Good morning and good night to our story. Over the melting sky, we bring our lullaby. Good morning and good night to our story. E hara taku toa i te toa takitahi, engari he toa takitini. E hara taku toa i te toa takitahi, engari he toa takitini. E hara taku toa i te toa takitahi, engari he toa takitini. E hara taku toa i te toa takitahi, engari he toa takitini. E hara taku toa i te toa takitahi, engari he toa takitini. E hara taku toa i te toa takitahi, engari he toa takitini.
Lovely.
Well done, Liana.
Uh,
We should share
So-
that one with Nicola to put on our LinkedIn. This
yeah,
is
it
so
was
good.
actually hard to only choose that, like, it could be
Yeah,
so
I
much
bet.
longer. There's so many more pictures. Yeah.
Yeah, yeah.
I tried to pick ones of some of the leads that I knew would be on here today. I found you, Joe and Renee.
Well done. Yeah, no, I love that. And good choice of music too.
Yeah,
Yeah.
we've actually purchased that music, so we can
Yeah, I
use it on
remember
anything.
actually from, yeah.
Mm.
Mm. Yeah.
Now I just saw Renee Ward jumped on just as you were on the screen. Did you see yourself? Oh, you're on mute.
No.
Oh,
Well,
but
we'll
you
send
can
it
pick
through
me
to
up on
you.
it. Yeah,
we'll send it to you, Renee.
thank you.
It was perfect timing. I was just letting you in, and then I was like, "We're on the screen together,
Yeah.
drinking mocktails."
Yes.
Just putting that out there.
Yeah.
Excellent. Well, thank you, everybody. I will be seeing some of you, at the end of the week, but, have a great week. Thanks for jumping on. Thanks for coming to the peer sessions this year, and enjoy the rest of your day.
Akite.